Hello and welcome to Health Professional Radio. I'm your host, Neil Howard. Real glad that you could join us again. Going to be speaking with Dr. Sarah Cross, Associate Scientific Director, Women's Health, U.S. Medical Affairs at AbbVie, and she's joining us on the program to discuss the newly formed Alliance for Endometriosis by 7 women's health-focused organizations. Welcome to Health Professional Radio, Dr. Sarah Cross.
Thank you, Neil. Really looking forward to sharing a little bit about the Alliance for Endometriosis with you and sharing this conversation with the listeners of Health Professional Radio.
Well, I'm glad that you joined us. Let's start by you giving our listeners a bit of your background. Tell us what it is exactly that you do. And I did mention your position there at AbbVie.
Absolutely. So I have a long history, Neil, in medical and scientific research and education. My Ph.D. was actually in cellular nanomechanics at UCLA and predominantly focused in the oncology space and novel diagnostics and evaluation, largely around women's related cancers. And fast forward to today, as you mentioned, I'm now at AbbVie. I've been at AbbVie for 4 years. Started out as a medical science liaison, and recently, about 2 years ago, joined our headquarters team. And as you commented, I'm the Associate Scientific Director for Medical Affairs at AbbVie, and I lead our endometriosis team. And it's really great to be here and share more about the Alliance with you.
Endometriosis, what is it? Who does it impact mostly? And what are some of the signs and symptoms of this condition?
Great question. So endometriosis is actually a chronic disease. It occurs when you find endometrial-like tissue that forms outside of the uterus. And typically, we find these lesions, as they're called, on the ovaries, on the fallopian tubes, on the pelvic peritoneum, and on other organs found in the pelvic area. We associate usually the triad of symptoms, Neil, with endometriosis, which are usually pain with menses or dysmenorrhea, pain between menses or non-menstrual pelvic pain, as well as pain with sex or dyspareunia. Now, the symptomatology can go beyond that, and other women experience symptoms with urination, etc. And these symptoms can be highly debilitating to some women and really prohibitive in terms of impacting day-to-day activities. And what they also is seen is that not only do these individuals have a significant economic burden at times, but also the whole disease has an economic burden on society as well.
Does it affect older women as well as younger women? Are there racial implications as well?
It's a great question. What we know, Neil, is that endometriosis affects about 1 in 10 women of reproductive age here in the United States. It's typically diagnosed in women who are of the age of 30 and 40. However, it can start as early as adolescent age when teens are going through their first and initial menses, and it can go beyond. So this is really, as I was saying, it's a chronic disease that goes across a lifelong continuum. So the diagnosis is, and we can talk about that later, is often delayed. And so women are diagnosed until much later and often living with this symptomatology and with the burden of disease before being diagnosed and appropriately managed. And really, there's not one demographic or ethnicity that has been associated with a predominant risk factor for endometriosis. Now, there are several other risk factors for endometriosis, and these are things that include family history of endometriosis, when women start their period at an earlier age, when their menstrual cycles are shorter, or if they have longer or heavier periods.
When you mentioned diagnoses a couple of thoughts ago, are we talking about a condition being misdiagnosed or not diagnosed due to not seeking care or asking questions early enough? Why is it often misdiagnosed or undiagnosed?
Yeah, that's a great question. Part of it revolves actually around normalization of the disease. We know that period pain is often normalized by society. So people with endometriosis may normalize their pain, as well as their loved ones or even healthcare providers. We also know that there's significant stigma associated with discussing menstrual health as a whole. And so we see that both in society as well as in physicians' offices. Now, if you look at the statistics, what we know is that it takes about 10 to 6 to 10 years on average for an individual to be diagnosed with endometriosis. And that's partly due to that normalization and stigma, but also there's a number of other comorbidities or confounding factors that may be associated with that. And I think women aren't used to necessarily going in the office, speaking up and advocating for themselves. And so that largely hinders the diagnosis as well. And then one last key point is that historically, and even to date, surgery really remains the primary method for diagnosis, with histology for confirmatory diagnosis. Mm-hmm. And so while the modern literature comes forward to elevate awareness around clinical diagnosis, many healthcare providers still lean on that surgical diagnosis, which often takes more time for women to be diagnosed and contributes to that delay in diagnosis.
Being a chronic condition, what historically has been the treatment to alleviate some of the symptoms?
Yeah, that's a great question. So there's a whole, I'll call it a toolkit of treatment options, and these vary from first-line medications such as NSAIDs, hormonal contraception, intrauterine devices, and then there's another class of drugs that go beyond just treating the initial symptomatology, because most of those either impact and cause decidulization of the local uterus, or from a hormonal contraception perspective, they regulate the cycle. Now, often women have, as I was mentioning earlier, pain beyond just that associated with their menstrual cycle. And so in order to impact positively, for example, non-menstrual pelvic pain or dyspareunia, or even dysmenorrhea for women, they need to go to a next line treatment, which would be something like a GnRH agonist or a GnRH antagonist. Mm-hmm. And then, of course, there's the surgical options as well, laparoscopy to excise endometrial lesions. And then for, full complete removal, the hysterectomy with or without removal of ovaries. Now, I'll just caveat that by saying, because this is endometrial-like tissue that is outside of the uterus, even removal of the uterus and the ovaries still doesn't alleviate the pain for all women long-term.
You mentioned that you were part of an endometriosis team. That's not part of this alliance for endometriosis that you're going to tell us about, is it?
No, our team is multifunctional at AbbVie. So we have, of course, I sit on the medical affairs side, so we really interface between clinical development and our commercial team, plus a plethora of other functions, health economics and outcomes team, et cetera. And we really, our goal in medical affairs is to translate the science and educate providers and patients on the latest evolving methodology around, for example, diagnosis, treatment options in the landscape, and also really elevate some of the key messages that we think are important from really hearing and listening to women, which are how to be heard, getting over that stigma and normalization, really how can they have better conversation and make informed decisions across that long-term treatment continuum, because this is a chronic disease and it's so important.
Now, this alliance for endometriosis is made up of, I think, 7 women's health-focused organizations?
It is, yeah. It's really actually quite exciting. So we brought together 7 women's health organizations that include the ACOG, which is the American College for Obstetricians and Gynecologists. It's ourselves, AbbVie, as well as the Black Women's Health Imperative, the Endometriosis Association, GE Healthcare, HealthyWomen, and the International Pelvic Pain Society, or IPPS. Now, these organizations have partnered to form the Alliance for Endometriosis, and with the goal of really inspiring conversations about endometriosis that can help lead to real and positive change.
Well, Dr. Cross, where can our listeners go online and get some more information about the Endometriosis Alliance and about the survey as well?
Yeah, great question, Neil. So the listeners in the endometriosis community at large can share their experiences via survey at allianceforendo.com, and also by using hashtag Let's Endo the Pain on social media. And Neil, one of the things that we're most excited about is really what the goal of the Alliance is, which is currently how do we actively listen to our endometriosis community. And so we're really excited for the recent launch of our survey on allianceforendo.com, which aims to do just this.
Well, Dr. Cross, I appreciate you joining us here on Health Professional Radio and giving us this information. Thank you very much.
Thank you.
You've been listening to Health Professional Radio. I'm your host, Neil Howard, in conversation with Dr. Sarah Cross. Audio copies of this program are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to the podcast on iTunes. Listen in, download it, SoundCloud, and be sure and subscribe to our YouTube channel at youtube.com, Health Professional Radio.